Hi everybody. I wanted to do a video on something called roseola. Roseola is a rash disease where kids get an incredibly high fever, sometimes upwards of 104 or higher, and that occurs for a couple days, so maybe 2 to 3 days, and that's the only symptom. They get a really high fever, and then after that fever, they break out into a rash, typically head to toe rash. That rash can be just a flat rash, something we say macular rash, or macular papular, which means you can actually feel it. When you press on the rash with your hand, that rash will blanch. It means that if you press on the redness will turn white, and then the redness will come back. That's how you sort of can tell the difference between the roseola rash and the measles rash. If you press on the redness of the roseola rash, it will go white and then come red again. If you press on the redness of the measles rash, it will stay red the whole time. Roseola can be very scary for parents because the fever is so high in the beginning and there are no other symptoms. So the parent is going, my kid has had fever for a couple of days, there are no signs of cough or congestion, and they're very fussy and I don't know what's going on. And as the pediatrician, we're normally like, in the first day, let's just watch it, it's just a fever. Day 2 or 3, we're going, I wonder what's going on, why is there this fever? Many pediatricians who've seen roseola before are going, I wonder if this is roseola. However, we won't know until the rash appears, because the cause of roseola is a virus. It's called HHV, human herpes virus, not related to herpes like the herpes that we see here, human herpes virus 6. And we won't know that your kid has roseola until the rash appears. But sometimes I'll be like, let's just see, give it a day or 2, and maybe the child will end up having a rash, or I'll have the kid come in, I'll do an exam, make sure their ears look good, make sure I don't see anything else or hear anything else, and then I'll say, let's just keep watching before we do anything else. Annoyingly, this is common in that sort of infant to toddler age group, like 6 months to 2-year-old age group. Sometimes we're thinking, could this be a UTI if it's a little girl? And you're wondering, are there any other things going on that you can't see? And so you kind of have to decide if you're going to wait and see if the rash is going to develop, or if you're going to do a urine screen or something like that. Once the rash appears, all is well. They're not contagious anymore. You can touch the rash, it isn't going to hurt. The rash is not itchy, it's not painful, you don't have to put anything on it, and the baby is going to be just fine. The virus itself is not going to create any problems. It's just fever and a rash. It's not going to create any major issues for anybody in the public. And it's just a really frustrating thing because of how it is diagnosed. You have to kind of wait for the rash to appear. Right now, where we are in the country as far as measles being a problem and other vaccine preventable illnesses, it can be very confusing given the fact that there are other illnesses that can be deadly that have rashes involved, and the confusion that that can create. Always a good idea to have it checked out, and remember to take your finger, press on it, and see what it looks like under that.